So you were going to the pain clinic in Great Falls.
Yes. And I was on oxycodone 30 milligram tablets, 180 of them a month, taken every 4 hours throughout the night. And anyways, I had a toothache one evening, and I took my dose of oxycodone, and I was still in a lot of pain, and I had hydrocodone prescribed to me from the past, so it was an out-of-date prescription.
Sure.
But I couldn't take another oxycodone, so I took a hydrocodone. And I went in the clinic the next day, and they UA'd me, and I got a letter that I was fired from the clinic for taking the hydrocodone.
When was that?
September of last year. And I've been trying to establish care. They've ruined me.
What do you mean they've ruined you?
I can't find a doctor anywhere.
Nobody will see you because of that, because of the fact that you were fired.
Yes. He's who I'm seeing now, and he's terrible. He made fun of my disability. I'm bipolar.
Where is he located? In Great Falls?
Great Falls Pain Clinic. He gives me 2 Oxycontin 10 milligram tablets a day, and it's not covered under my insurance.
Why is that not covered?
It's a medication that my insurance doesn't cover.
So that's really expensive, isn't it?
Yes. And he refuses to put me on the oxycodone, which my insurance covers.
Do you know why he's refusing that?
He says I'm bipolar, and bipolar people can't be trusted.
Jesus.
And I see here in town for that. I take medication. I'm under mood stabilizers.
Sure.
My bipolar is controlled.
But he won't take care, he won't prescribe for your pain.
No.
And you're taking Lyrica still?
Yes.
Wow.
Before, but he doesn't treat out of town patients.
Mm-hmm. And who's your brother that referred us? Mm-hmm. What did he say about our clinic and what we would do?
He said you might help me here.
Okay. Like there's some kind of passiveness. I mean, you call and they don't call you back, or you see the guy in Missoula and he doesn't return your calls or anything.
Right.
And that's weird.
It is, especially for benefits now. I don't understand that.
Yeah. So it's just something to. It's just like the pharmacist. They don't have to give you the pills.
Right.
I guess a surgeon doesn't have to. They can see you, and he's seen you.
You don't have to,
He doesn't have to do anything.
so maybe go see a different one then.
I don't know.
It's $299 without insurance, whereas versus these are $37. And you gave me enough for 7 days, which I've had to double up on because I haven't had those.
Right.
When I had those 3. My blood pressure dropped down to normal. My anxiety level. I mean, we finally found something that worked.
So you had OxyContin, and I wrote you 30 of them, and Kmart filled 3.
Yeah.
And there's no OxyContin in the rest
There
of this
is now.
town.
Dory just called me a while ago. She said the truck came in this morning and she has them, but the PA still hadn't. You know, I can pay cash for these, but there's no way I can come up with $300 for those. until the PA goes through. I mean, it should be by tomorrow. It's been since like, what, last Wednesday?
So here's what's unmanageable about this. I don't have a fucking crystal ball about how to say when you're going to get a prior authorization, and I don't know what to write. Without a prescription, they won't do a prior authorization. This one's been destroyed, I'll do another one. So the problem with that is you're not going to get your pills until you get them.
The good ones. I mean, the ones that really work.
OxyContin.
These are short term, and you know, like I said, I had to double up on them over the weekend, which there's 7 days worth.
You didn't have to double up on them. You doubled up on them.
Well, I was hurting. I mean,
I know. That implies that you're entitled to pain relief.
and plus I could feel the anxiety
I know.
coming back
I know.
and the
I
blood
know.
pressure coming back.
I know. Like,
And dealing with these at Walmart, you know,
so what happened at Walmart?
2 days they had the prescription. They never, you know, they was hoping that the PA would come through. Well, cash price is $299. I said, well, there's no way I can do that. Well, then you need to come get your prescription.
Okay. So you came and got it.
Yeah, went and got it.
So how are they?
Well, she was being rude to me. It's like my doctor, just because he's under scrutiny and I'm under scrutiny, they want to hold it, you know, against me. I mean, they didn't come right out and say, you
Right.
need to find another doctor. But they were basically implying, you know, you got to do something else. And I said, well, we finally have found something that works. I mean, he's been dealing with me, and he cringes when he sees me come through the door now. I said, we finally found something that works. It's got my blood pressure down. We're able to drop the Xanax. And, you know, so in the meantime, this time, I'm going to let Kmart have them. And hopefully by tomorrow, the PA will go through. And in the meantime, I can pay cash for these.
Okay. So you got rid of your primary care doctor because why?
Because she tells me how I feel and she doesn't give me the chance to tell her how I feel.
All right.
Yeah. And,
Good idea.
And their last resort, if all else fails, they tell you you need a colonoscopy.